Hello everyone, I am Dr. Abdullah Horania, MD Unani Medicine. Today we will discuss leech therapy. What is leech therapy? It is also called Hirudotherapy or medical leech therapy. In Unani medicine, it is also called Amale Talik. It is a very ancient procedure in which we use medicated leech on the patient's body in order to cure the disease. It is very old. History suggests that it is found since Greco-Arabic medicine, Roman Empire, 1700 BC. What is the indication of the treatment where we use leech therapy? Well, first we use in the skin diseases such as eczema, psoriasis, chronic non-healing wound, non-healing ulcer, flap. So, how leech work? So, mechanism of action is like leech secrete particular saliva which has more than 20 bioactive substance in it, such as hirudin, eglin, antistatin, glomerin, serratin, bidalin, complement, etc. And action, the leech saliva has analgesic action, anti-inflammatory action, platelets inhibitory action, anticoagulation action. It increases blood circulation in a particular area and improve the condition. Before going to leech therapy, the prerequisite you should have is blood test. You should have fasting blood sugar, CBC, complete blood cells, bleeding time, clotting time, LFT, in order to exclude liver and skin and blood infection. Thank you. How is procedure performed? So first we collect the leech from leech distributor or vendor. We should be fresh. Then before applying on the patient's body, we just dip a leech in a fresh water, which should be at the normal room temperature. Then after that, we clean the area of the deceased patient where we want to apply the leech with normal water. Leech are very sensitive animal. So if there is any ointment, fragrance, odor, they won't suck. So we should clean with normal water and then apply the leech. Maximum 4 to 5 leech at one side of the area. Leech take 30 to 35 minutes to suck from particular area, and approximately 50 to 60 ml of blood is sucked in each leech. During this process, we put a small gauze piece over the leech in order to have a cool and calm environment for sucking. After application of leech, what comes is a post-care treatment. Like normally leech remove the site of sucking after 30 to 35 minutes. After that, we should do clean dressing and compression bandage over the site of sucking in order to prevent excessive bleeding and hemorrhage. Later, we do vomiting of leech with the application of turmeric. So in order to vomit and evacuate the entire amount of blood which leech has been sucked. After that, we put it in a water mixed with turmeric and we clean 2 to 3 times and put in a safe and clean container containing water. At least we should keep 15 days gap for each leech for second sucking. And one of the most important thing is we should avoid use of leech from one person to another person. So what complication we can have after leech therapy? Since it is a medical procedure which include blood and bloodletting things, so there are very chances of transmitting bloodborne infection such as STD, HIV. So in order to prevent, we should use separate leech for separate patient, strictly. And the second thing, we can have infection, anaphylactic shock, we can have bleeding, vasovagal symptoms, Patient may have discomfort, itching, scaling, and sometimes erythematous rashes over the site of leech bite. Thank you. Leech therapy or medical leech therapy or hirudotherapy, is it scientific procedure or what? So it is under evaluation and many research paper has been published since long. So it is evidence-based medicine which is used for reconstructive surgery, plastic surgery, reversion flaps, and places where microflaps are used, and in order to increase the circulation, it is used. So there are various research papers published on leech therapy, hirudotherapy, medical leech therapy, amaletali, or raktamoshna, or jalota, which has been given and shown. Thank you.